Welcome to another episode of ECREM FOAMed videos. Today I will be demonstrating special tests used in knee examination. Knee injuries are quite frequent presentation in the emergency department, and as a part of knee assessment we do certain special tests to look for certain specific injuries. Today I will be demonstrating anterior drawer test, posterior drawer test, Lachman test, Tessery test, Apley test and McMurray test. We will be demonstrating two tests for anterior cruciate ligament tear, namely anterior drawer test and the Lachman test. For anterior drawer test, the patient has to be lying on the bed with his knees flexed to 90 degrees and foot resting on the bed. The physician then stabilizes the leg by sitting on the foot of the patient while resting his forearm on the patient's tibia. He applies pulling force to elicit any anterior displacement. For Lachman test, patient is supine with his knees flexed to 30 degree and the physician will place one hand on the anterior aspect of the thigh while the other hand on the posterior proximal tibia and apply pulling force to elicit anterior displacement. For posterior cruciate ligament tear, a posterior drawer test is performed. For posterior drawer test, patient has to be lying on the bed with his knee flexed to 90 degree and foot resting on the bed. The physician stabilizes the leg by sitting on the foot of the patient and while resting his forearm on patient's tibia, he applies a backward pushing force to elicit any posterior displacement. Apley's grinding test involves placing the patient's knee to 90 degrees. The examiner then applies pressure to the patient's foot while laterally and medially rotating the tibia. Pain while applying pressure suggests meniscal tear. McMurray test is done for medial and lateral meniscal tear. For this test, the patient is placed in supine lying position. To check for medial meniscal tear, the examiner places his finger along the joint line laterally. He then flexes the patient's knee and externally rotates the foot while applying valgus force to the knee. He then gently flexes and extends the knee, looking for a clicking sound. To check for lateral meniscal tear, the examiner places his hand along the joint line. He then flexes the patient's knee and internally rotates the foot while applying varus force to the knee. He then gently flexes and extends the knee, looking for a clicking sound.